Let me tell you about one of my patients that I had the honor of taking care of as a medical student. She was a young lady, 14 years old, and now faced with her first pregnancy. As a medical student, we often had to go in and get histories, and that included getting a dietary log that the patient had to complete. You will never know the pain and place of just disbelief that you feel when you have a 14-year-old child, not woman, child, look up to you and say, "How do you spell hamburger?" In that moment, in that space of me as a 25-year-old woman, my heart bled for that patient because I knew she had no idea how hard the road would be for her. I have seen countless variations of this story that have only renewed my certainty over the course of my 20-year career that abortion is health care. From the student who was the first in her family to attend college, who feared having an unplanned pregnancy and that it might interrupt her career and her ability to provide for generations of her family. From the woman who's in an abusive relationship and has no say in her own reproductive decisions, but who also cannot, through compassion, bring a child into such situation as the one that she's living in. For all of these women, I stand here today. I have been a provider of these women. I have been these women. How dreadful that our daughters and our sons, because let's not leave them out of the equation. How dreadful that they will not have the same reproductive health choices, economic choices, and empowerment choices. Because again, these choices not only affect the individual, they affect families, communities, and lastly, they affect my oath as a physician and protector of people. When people ask me what it's like to work as a physician in a state that has banned abortions in all cases except for the life of the mother, my answer is simple. There's not much to be done in handcuffs. Abortion is a Class C felony in the state of Tennessee. Not much can be done when you are forced to change your occupation from physician to lawyer every time you decide how to treat a complicated pregnancy. Now, when my colleagues refer patients who require termination for any reason, be that anomaly, be that elective, my only recommendation is you have to get her out of state. When they call and say she's bleeding, but there's still a heartbeat, what do I do? My response is consult your legal service and try to minimize her risk in the interim. So essentially, that has been my job, working against all that I have ever been taught, ever been trained as a physician. And my hands are tied and harm is being done. Thank you.